Today in this lecture we will discuss the quantitative importance of cardiovascular reflexes and osmolarity in stimulating antidiuretic hormone secretion. So far we have discussed in detail that antidiuretic hormone is secreted by changes in osmolarity, plasma osmolarity, as well as it is secreted with the help of cardiovascular reflexes in the areas of brain from which it is secreted and with the help of which it is secretion is stimulated. We have discussed those in detail in our previous lecture. In this lecture we simply look at the quantitative importance of both type of reflexes. Either the cardiovascular reflexes is more effective or the changes in osmolarity is more effective. Now this graph shows the release of plasma ADH. This is increase in the plasma antidiuretic hormone, and this x-axis is showing the percentage change. This is showing the percentage change in the plasma osmolarity in the pink color and the volume, the plasma volume in the green color. Now it is very much clear from this graph that even a small change, even a 1% change in plasma volume, even a 1% change in plasma osmolarity with the same volume, the volume of the plasma is same, but there is change in osmolarity, which is known as isovolemic osmotic increase. It will lead to increase in antidiuretic hormone. It will rapidly lead to increase in plasma antidiuretic hormone. But on the other hand, if we look at the changes in blood volume or plasma volume, but the osmolarity remains the same, which is known as the isotonic volume depletion. There is decrease in the blood volume, there is decrease in the blood volume or plasma volume, but it is isotonic. There is no change in the osmolarity. So it will not directly lead to the increase in plasma ADH. Rather, the plasma ADH initially will remain the same until and unless around 10% change, unless until around 10% change has occurred. Here you see, even with a small increase, even with a little increase, the ADH has gone to this level, and then it has gone to this level, and then it has gone to this level, even with small. But here we see that to gain this much change in the ADH, we have to bring big change in the volume of plasma. So after around 10 to 15% change or decrease in plasma volume, we can expect a big increase in antidiuretic hormone. So the significance or the meaning of this graph is that initially antidiuretic hormone secretion is more sensitive. It is more sensitive to changes in osmolarity. It is more sensitive to changes in osmolarity. But once there is a big decrease in plasma volume, then the plasma ADH secretion increases, and a big decrease in plasma volume helps in increased stimulation of the antidiuretic hormone, even with the same change in osmolarity. So initial release of ADH is more sensitive to changes in osmolarity. Even 1% change in osmolarity will lead to increase in plasma antidiuretic hormone, and the change in volume with the help of cardiovascular reflexes is not initially that much effective, and we need around 10 to 15% change initially to bring increase in plasma ADH. But once there is a big decrease in plasma volume, then it enhances the stimulation of plasma ADH to a big level, and it increases antidiuretic hormone even higher than changes in osmolarity. So that's the quantitative importance, and that's the quantitative importance of both the cardiovascular reflexes and osmolarity in stimulating the antidiuretic hormone secretion. Thanks a lot for watching the video.